and trying to sort of really explain to people what being a governor for Northamptonshire Healthcare Foundation Trust is like, or would be like. And we'll try our best in the time we have available to give you a flavour for that. So we won't go into a huge amount of detail, but you can always ask any questions that you'd like to subsequently of us. But would it, I mean, I hesitate because I don't want to take up too much time with introductions, but maybe we could all just say very briefly, if that's all right, literally like, 10 seconds, who you are and just what your role is. So if you happen to be a member of staff, or which I know some people are, because obviously we can see that through email addresses and because people are more familiar, but equally you may be somebody who has a different connection to the trust. And so a very brief mention of that would be great, because we'll probably need to kick on to make sure we cover everything. So just to say, I'm Christy Waring. I'm the chair of the trust and therefore the chair of the Council of Governors. Delighted to see so many people actually on our session today. And Richard and I, with Helen's help, will explain a bit about the governor's role. But I'm just going to go around the room. I say the room, but you know what I mean, around the virtual meeting, and just ask everyone to just introduce themselves. Now, bottom right, I've got a gentleman whose name's coming up as Sarah Jones, but I don't know whether that is your name, but please do introduce yourself.
Using my wife's laptop, so apologies for that.
That's all right. It's a common thing that we have experience of. So sorry, I didn't catch your name.
It's Glenn.
Glenn.
Yeah. So yeah, Glenn Jones. I started working for the trust as a volunteer driver, and then in March I was asked to become a bank driver because of the pandemic. So from then until Christmas. No, till November. Oh, when was it? Till recently, I was a bank driver, and because we're back to full staff now, I've gone back as a volunteer. So that's my introduction to the trust.
Great, thank you very much, Glenn. That's really helpful. Kurt, please, next.
Hello, everyone. My name is Kurt McKenzie. I'm a community dental officer.
Kurt, I think we're struggling to hear you a little.
Can you not hear me at all?
Is that just me?
No, I can't hear him.
No, I can't hear him.
Sorry. I'll try my microphone again.
This might be your setting, Kurt. I don't know whether, are you on a trust, are you a trust colleague, a trust member of staff? Or
yes.
Have you got a volume, speaker volume right in the bottom right of your computer? Not really, but don't worry, Kurt. We'll keep it fairly brief, and then if one of us can hear what you're saying, then we can always relay it to everyone else. So.
A little bit closer to the laptop. My name is Kurt McKenzie. I'm a community dental officer working for the trust, but I work out of Willowbrook and St Andrews Healthcare.
Brilliant. I did hear that. Hopefully everyone else did, but Kurt is a community dental officer, if I heard that right, out of Willowbrook. So great, brilliant. Thanks, Kurt. Gary?
Yeah, hello, good evening, everybody. My name is Gary Coles. I work for the Trust and I'm a clinical skills trainer.
Brilliant.
Welcome
Thanks,
to you all.
Gary. Thank you. Thanks, Gary. Hi, Joe. Do you want to say, oh, Richard, sorry, I'm sort of happily missing you out, but I can see you put your hand up as well. So
no
I'll
problem.
come back to you, Joe.
Hi, everybody. I'm Richard Smith. I work in the corporate affairs team as head of corporate governance. My somewhat rude interjection is simply to highlight that we've got the chat function available to us. So if you are wanting to post a comment or to communicate, and I was thinking particularly, Kurt, of your difficulties with the microphone, do please use the chat function and we can either read messages out or pick them up in there.
Great. Thanks, Richard. Joanne? think you look like you're up. There you are.
Is that okay? Hi, I'm Joanne Dalrymple-Smith. I work as a specialist home enteral feeding dietitian, covering Wellingborough, Rushden and Daventry. So pleased to be here.
Great, thanks, Joanne. Robbie, I know we touched on your background briefly, but as a lot of people weren't there at the time, perhaps you could just say that again.
Yes, I'm a involvee with NHFT. I've been with the Autism Strategy Group and the advisory panel, Asperger's advisory panel, for 3 years. I've got lived experience of ASD, ADHD and depression. So I've been a service user of NHFT services. I'm also a member of my surgery, my GP practice patient participation group, and I'm going through transgender gender transitioning at the moment.
Thank you so much, Robbie. Thank you for sharing that. Louise?
Hi, I'm Louise and I work as an admin officer for the dietitians at Kettering General Hospital. So I work alongside Joanne previously. That's it.
Okay, thanks, Louise. And Helen?
Hi, I'm a current NHFT governor. I'm a public governor representing Northampton. I don't know if you're queuing me up for a separate slot later, Krishni. I'm guessing you are. So,
yes.
But from what I've heard of everybody so far, I think you're all the experts. I'm the newbie here.
Thanks. And clearly we've got a dog somewhere in the background as well, and so that's absolutely fine. This is very informal, everyone, and I think there'll be an opportunity briefly for Helen to kind of explain what her experience is of being a governor, because she's been working ably as a governor since April, I think now, April last year. So now I can also see Esther Tennant, the name Esther has come up, so I'm just checking. Esther?
Yeah, that's actually my daughter's name. I'm called Ali Tennant, and I have no connection with the trust other than I signed up for some emails and I'm just exploring about whether to be a governor. I have a daughter with mental health issues, so that's where my interest lies.
Okay, so was it Ali?
Alison.
Yeah, okay, that's lovely, thank you. Okay, I think we've also got Nikki in the background. Nikki is the HN or NH, because our trust emails will always put our names the other way around. So Nikki is going to just help us with the event, if you like. So we need to crack on just to make sure everyone kind of understands what we're going to cover. Richard, have you got the slides handy that we were just going to put up?
I have indeed, yes.
So whilst Richard's doing that, I'll just say, you know, if you did get successfully elected as a governor, you would have a proper induction, and you know, we'd go through the role in detail. This is, I think, just an opportunity for us to give you a bit of a flavour of what being a governor is like and all about, and particularly having Helen here gives us the opportunity to tell you what it's really like, because she's actually, you know, the person who's kind of living the experience currently, whereas Richard and I you know, we're working with the governors, but you know, we have to acknowledge that everyone's experience of being a governor will be slightly different. But really delighted to see so many of you here, and we're just going to literally whip through a few slides to give you a bit of an overview, and then hopefully take some questions. Richard, did you want to come in before I started?
Yes, just very quickly, Krishni, to highlight that we're intending, with people's permission, really, to record this part of the workshop so that we can publish the presentation aspect for others that perhaps couldn't attend one of these sessions. So if everybody's comfortable with that, we would seek to then use the recording on that basis after the meeting. So I just wanted to point that out, as you may have seen a notice at the top emerge on your screen, signalling a recording is about to start.
So is everyone all right with that? Because I think, you know, you do need to feel comfortable with that. And if you don't want to appear on a recording, then please don't worry, but please say, because it's important that you feel comfortable. And, you know, if people aren't comfortable, then obviously we can either delete your you know, your name out or whatever. And Ali, I think you're not on screen anyway, but was that you wanting to come in?
I'd just rather you took my name off, because it's obviously not my name. So
Yeah.
other than that, I'm happy with being recorded.
Okay, that's lovely. Okay, I think in very simple terms, becoming a governor with NHFT, or Northamptonshire Healthcare Foundation Trust, is a different way of making a difference to our local community and to NHS health and wellbeing services, if you like. And making a difference is something we talk about a lot, because it's one of, you know, it's our mission as an organisation to use our resources and our capabilities to help make a difference to our community. So becoming a governor is one of many different ways in which people in our community, and that includes staff, obviously, and people who care for others, as well as patients and service users. It's one way in which you can make a difference. Many of you already are using other ways, like being, you know, a staff member already, or volunteering in different ways, or becoming involved in patient participation groups. A number of different things that you've said. So we're already all contributing, and becoming a governor is just one additional way that, you know, will suit some people, and you might really enjoy having that additional opportunity. So if we move on to the next slide, Richard, I think we can say a little bit more about the trust and then the role of the governor. So as an organisation, this will perhaps be more familiar to those of you who work for us already, of course, but we are rated as a outstanding organisation in terms of quality. That doesn't mean we're perfect, though, and I think it's really important to say that. We are regulated to be outstanding from a quality point of view, but that is, as ever with regulation and inspection, it's a moment in time. And as I always say to people, today's outstanding might be tomorrow's good, because things are changing all the time, and we as an organisation have to keep up with that and to keep improving. So it's a, you know, actually quality is always a journey rather than a destination. And it sounds trite, but it is really important that as a philosophy we focus on continuous improvement. So again, hopefully one of the things that you might be able to help us with, in addition to what you already do, is how do we keep that focus on continuous improvement. So obviously we have a diverse range of services, you know, really diverse range, being a community mental health organisation. We do sort of some things that are fairly special, like prison healthcare services, for example, which not every NHS organisation provides. But we also do other things that many of you will be familiar with, like district nursing, or community nursing as we call it, technically. And of course, well, you know, some of, I think Louise mentioned she supports a team of dietitians, and there are dental services. There are obviously a range of mental health services, as well as a range of other community services. So we are one of 3 NHS organisations providing services in the county, and no doubt you'll be familiar with Northampton General and Kettering General, which are the 2 acute trusts that also provide services. But interestingly, as we've already said, some of our staff, because of the nature of what we do, will be based in those other sites for those acute trusts. They'll also be based in our own sites, or perhaps even in GP surgeries. So there's a range of different places in which our staff work. I think last count, Richard, I think it was about 60, wasn't it? About 60 different sites on which our staff work.
Yes, I think it depends whether you capture GP searches on there, but there's certainly well over 50 sites that we use routinely. Yeah,
Okay.
absolutely.
Yeah. So a very diverse set of services dispersed across the whole of the county, looking after the needs of a lot of different patients with different needs. So I've touched on our mission already, which is making a difference for you and with you. And our vision is to be a leading provider of outstanding compassionate care. And that's, as I said, an ongoing challenge. So we have 4,500 staff. The number is a rough number because actually that number varies, and it also depends how you count, whether it's full-time equivalent or head count. But roughly that's the number of staff we have in our organisation alone, let alone in the other trusts in the county. And then we have 12,000 members. Now, members are people who just sign up, I think possibly like Ali said she'd done, to receive emails and information about the services we provide. And actually it's important because members are the people who vote in elections. For people to, when you stand for election as a governor, it's our members who actually vote. And anyone can be a member. I think quite a large chunk of those members are actually staff already. But important to say, you do have to be a member in order to become a governor. So if you haven't already signed up to be a member, you will need to do that in order to stand for election. I think that's correct, isn't it, Richard? Do you want to add anything to that?
It is indeed, yes. The only thing I would say for the benefit of staff members that have joined us this evening, it's not an automatic process. Because you're a member of staff, you're also a member. So if you are wondering, am I a member, then do contact us at the Foundation Trust Office and we can confirm for you. And it's a relatively straightforward process, either for a member of staff or indeed for anybody else actually to become a member. So if you're unsure, do contact us and we can help you.
Okay, great. Thanks, Richard. Can we move on to the next slide? So we have a range of different governor opportunities, if you like, and they represent different constituencies within our establishment. So we have public governors, very simply, who represent members of the public from around Northamptonshire and beyond. We also have what we call service user and carer governors, so people who have experience of receiving our services as a patient or service user, and also people who care for others who might be receiving services or who have caring responsibilities within their remit. We have staff governors, so obviously employees of the trust who would like to become staff governors, and then partner governors who are actually appointed by their respective organisations. So they're not elected, but they're appointed. So as an example, we have Age UK is one of our partner governors, and they nominate somebody to represent them on our council. But for all the other constituencies, those roles are elected to, and we'll come on to tell you a bit more about the election shortly. But fundamentally, how do governors make a difference? There are sort of two elements to it, really, but the main opportunity is a chance to represent your community. So if you are, let's say, a service user governor, then you have the opportunity to represent service users within our council, and similarly with other roles. So it just allows different parts of our community to play a role in influencing what happens with NHS provision in in Northamptonshire and a little bit beyond that too. So it's a flexible role. It very much fits around your capacity. There aren't many things we absolutely ask you to do, and particularly during the pandemic, it's been difficult to expect everyone to be able to attend meetings and that sort of thing. But the core of the role is to attend our councillor governor meetings and to contribute to the decision making and the discussions that take place as part of that. But beyond that, it's very much about you really shaping ways in which you can contribute. And one of the benefits of having Helen here is she can talk you through some of the practical ways in which she might have got involved, and different people will have different stories to tell, and I think it's important to say that. So there's a real opportunity to shape your involvement in the Council of Governors and your role as a governor to your own personal circumstances, albeit you're actually in the end working together as a group to make decisions about future direction and to represent your community. Hopefully that makes sense. I think we'll move on to the next slide, which Richard, perhaps you would like to cover, just to explain really just a bit more detail about the council.
Yes, of course. So as Krishna's already mentioned, there are a number of different what we call constituencies representing different parts of our communities. And as you can see here on the slide, we've broken down those individual constituencies, so the public governor role that Krishna was describing, service users, etc., into a little bit more detail, so you can see specifically how many representatives on the council there are for each of the different constituencies. So the top left-hand side of the chart here, you can see the different regions of the county, which for those people that do live in Northamptonshire, you'll be familiar with as some of the electoral boundaries associated with our local authorities. So Daventry and South Northants council area, Northampton council area, of course, shortly to become part of the unitary councils that are forming across the county. You can see in the bottom left-hand side of the chart then the service user and carer constituencies, and these are quite broad categories that don't differentiate between a mental health service user or a physical health service user. They are just broad categories related to age at the moment. So an adult service user being somebody that's over 25, and a younger service user that is below 25 and over 12. And indeed, we've also then got a constituency of carer governors who, as the name suggests, represent our carers. So moving over then to the right-hand side of the chart, as Krishna mentioned in relation to Age UK, we have a series of partners with whom NHFT works as an organisation, who are listed there in the top right-hand side. So I already mentioned the councils, which we will need to be changing as the council landscape changes over the coming year. We've also got the University of Northampton, the Criminal Justice Services for adults and for children, NREC, or the Northamptonshire Rights and Equalities Council, Age UK, as Krishna mentioned, and Northamptonshire Carers, the carers organisation that serves the whole of the county.
Thanks, Richard. Is it worth just mentioning, so I think we've got a number of these seats are up, aren't they, for election, but not all of them. So I think one of the things that you'll have to practically think about as potential candidates, if you like, is which one of these constituencies is actually one that you might fit into, but of course it has to be open for election. And I don't know whether we've actually got the list of actual vacancies, Richard, which I've suddenly realised perhaps we should have highlighted on the slides, but we can share that, I guess, at the end, maybe.
We have indeed. So what I'd also say probably at this point is point people towards our website. So if you go onto the NHFT website, there's a page on the website dedicated to governor elections, which is simply nhft.nhs.uk/elections. On there, you'll find a list of the posts, or the seats, I should say, that are currently up for election. I think there are 19 from memory across a broad swathe of the constituency you can see there. What we'll also do is just make sure that everybody that's joined up this evening to the call has a copy of the notice of elections, which again specifies the seats that are up for election this time round.
Great, thank you, Richard. So I've got a feeling, is there another slide that we need to cover, or should we hand over to Helen? Okay, do you want to cover those points, and then I think we can hand over to Helen to actually try and maybe just spend a few minutes explaining what it really feels like to be a governor.
Certainly. So yes, I think as we've already said, NHFT's mission is about making a difference for and with people, and governors are a key part of that. Although there are lots of different types of governor that we were just describing in the previous slide, actually all governors are equal. So actually everybody's got an equal voice on the Council of Governors representing their constituents. As Christian has mentioned earlier on, the key way in which the governors actually fulfil their role is through meetings. These meetings, unfortunately or fortunately, I suppose, depending on how you look at it, during the COVID pandemic have had to happen like this, using Microsoft Teams. We've managed to maintain a regular schedule actually of Council of Governors meetings during that period of time. So the authority that the governors actually have to make decisions, as alluded to in terms of governors being equal, comes from the collective. So actually governors voting together as part of the Council of Governors have the authority to make those decisions. And indeed these decisions actually come from underpinning legislation, so the NHS Act 2006 and the Health and Social Care Act 2012. So in other words, that really underscores the fact that governors do really have a very important role within NHFT. So these two roles split into two elements, really. So one, as the next bullet point on the slide here suggests, is actually holding non-executive directors like Krishni and her non-executive director colleagues on the board to account for the performance of the board. So we have a strategy and a plan that says what the trust intends to do for the benefit of the people that we serve, and it's the board's responsibility to deliver that plan. So the governor's role in holding to account is really making sure that the board is delivering what it signed up to deliver for the benefit of patients and the wider public. The second really important role that governors have, which is the last point on this slide really, is representing the interests of their constituents, their community. What this means in practical terms is really advocating on behalf of the people in that constituency in relation to major decisions that the organisation might be making. So that might be about introducing a new service, it might be actually in setting the strategy or the plan that I just mentioned, making sure actually that that plan takes account of the needs of people living in Wellingborough and East Northants, for example, or adult service users. So actually, as a collective on the Council of Governors, governors are then influencing the strategy and the plan of the organisation in moving care forward across Northamptonshire and indeed across the services that NHFT provides in other parts of the country. So hopefully that makes sense, but in a nutshell, that's the way in which governors make a difference here at NHFT.
Thanks, Richard. So I think it's now a moment, if I'm correct, I think if you switch over to the next slide, making a difference, my governor story. So it's your opportunity, Helen, to just maybe just bring it to life a little bit, to say, you know, tell people about your experiences. As we've said, I think it's worth bearing in mind that lots of different people kind of work differently in being a governor, but we just thought it'd be lovely for people to hear what it's been like for Helen. So over to you, Helen.
Thank you. Yes, you can see the slides have gone. I don't have a slide. It's just me talking, I'm afraid. It's really nice to see everybody, though. You don't get out much these days, do we? So it's makes a change to be out and about this evening. I was elected last April, and it's quite different to most of you, I think. I don't work for the Trust. I didn't have any experience of the Trust before getting involved. And in fact, I didn't really know what the Trust was, to be honest. If it hadn't have been for my next door neighbour going, Helen, you really ought to get involved in this, I probably wouldn't have done. Because I'm passionate about the NHS, and one of the reasons for that, the sort of backstory, I suppose, is that a friend and neighbour of mine underwent quite a lot of care through the hospital system, and I helped look after her when she came home. And it was when I'd experienced that connect or disconnect between hospital care and then community care, I thought, goodness, couldn't it be easier than this? Shouldn't it be simpler? Why can't I work out where you go for the information or the help or the advice? And that was what got me thinking, is there a way I can do something about this. And talking to my neighbour who used to be a non-executive director for the Trust years ago, and he said the Trust do all of the community healthcare in Northamptonshire. So I became a member, which was really easy. If you're not a member already, it's very, very straightforward. You can just go on the website, click a link and fill in the form. I was standing against 2 other people also who I didn't know, and to my surprise was elected. So I've lived in Northampton for the last 7 years, and I was a bit daunted at first, I have to admit, because I joined and there's 37 other governors and you think, wow, what do we do? How do we do it? But you get a brilliant induction training. So everybody gets introduced to other governors. You get buddied up with governors who are already in the Trust and working as governors. And you get a really warm welcome into how it all works. And then it's kind of down to the individual. So depending on how much time you've got and what your particular interests are, you really can pursue your passions. There's so many opportunities to get involved. We have a Council of Governors meeting every 2 months, which we do need to turn up to, because that's where we discuss what's happening in the Trust and any decisions that we're being asked to make on the things that we look after. But you also have the opportunity to observe board meetings, which is a great way of finding out what is happening. I know anybody who's an employee who works alongside the Trust will already know you get a lot of information anyway. But as a governor, you really start to understand how the Trust is working and what its priorities are. And then that extends out into thinking, well, how does that affect the people who I am looking after or who I am representing? So if you're a staff governor, it might be staff concerns that you feel aren't being heard in a certain way, and you might want to ask through the Council of Governors how the non-executive directors are actually asking those questions for you on the board. So you've got to root in to actually understanding how the Trust's working and being able to have a voice through the Council of Governors to say, these are our concerns, these are the things we'd like to have more information about, or perhaps make suggestions. These could be the directions of travel for the future. And joining the Trust in the time of the pandemic, I've actually not met a single other person in real life in the Trust at all. And yet we've all become very close to each other over the last few months. We found creative ways of working. And although we felt like a lot of things had shut and we haven't been able to get out and see people, I've been able to make some connections locally with people I know who are involved in schools. So I've been able to have discussions about being an NHS governor alongside people who are school governors. So we've been able to start conversations about what's happening in the school communities, in the local community, and finding out what people are worried about, what their concerns are, what perhaps they'd like more information about, because NHFT does a lot, but not everybody outside in the local community knows what we do. Often it's only because you've experienced a certain care service or a certain department that you know what it does. I mean, I'd never heard of specialist dentistry before now. It was news to me. So it's educational. It's very, very inspiring because we get to hear the stories of the people who are working in the Trust. It gives us a better understanding of how the Trust connects with our communities. So when we hear people's concerns, perhaps friends, family, neighbours, we know where to go for the information for them. And we're also able to tell them what we know about what the Trust's doing. And as the unitary authorities come into place and things around the county change as well, and everything becomes more integrated. And we've seen through the care homes through the pandemic how important that integration process is and that communication process. We're able to have a voice, a real voice, and to say, of the groups we represent, these are our concerns, these are our wishes for the future, and this is the feedback from the people that we're representing. I don't know how long I'm supposed to talk to it for. I'm looking around eagerly to see if anybody's got a stopwatch up, but if anybody's got any questions or anything they'd like to know, then I'm more than happy to answer anything.
Yeah. Helen, that's absolutely brilliant. I mean, I think Helen's put in a nutshell, I think, that the kind of her personal experience. And as I think it's difficult to say that everyone will have exactly the same experience, but I think Helen's a great example. And I'm not just saying it because she's here in the room, but she's a great example of someone who's just kind of launched herself into it and thought, well, how can I make this work for me and in a way that is meaningful? And as a result, the schools engagement project that she's working on at the moment is just a great example of that. And it's not something we were doing before Helen came along and suggested it. So it's not about necessarily what the trust is doing per se, but about what connections you can help the trust to make into our community with your own networks, your own other groups. And I think even as a staff member, as Helen said, I mean, whilst you may know more, you might receive communications, a lot of communications from the trust, you'll get to see a slightly different perspective. I think you'll get to hear more about strategy of the trust, perhaps than you normally do through kind of traditional communication. So and you have a lot more contact with the board, frankly, because the board works closely with the Council of Governors. So you get to see me every couple of months and more. I mean, I try and speak to governors on an individual basis. So it's really a really important relationship between the council and Council of Governors and the board, all about trying to make sure that our organisation that we're all care about is being run properly in the interests of our patients, our community, our staff, and helping us to have that two-way dialogue, out into the community, and making sure that we're all doing the right thing. So hopefully that gives you a bit of a flavour. I'm conscious that we said this was going to be half an hour. I'm not sure we've ever managed to run this event in half an hour before, Richard, so maybe we'll need to review that. But I do wonder whether there are any questions. I think there is a final slide, Richard, which is actually the election timescale. So maybe we could quickly flick that up and then have a few minutes of questions for anyone who needs it.
Okay, just bear with me a second whilst it's loading up. Right. Okay, so as you can see here on the slide, we've just mapped out some of the key dates for our current election process. So the first key date, as you can see here, is the 4th of March, which is the deadline for the receipt of nominations. So if you're attending tonight or you're thinking about somebody that's not here tonight. Sorry, Helen.
It's the wrong slide.
Yeah, we can see
it just says make a difference becoming a governor.
Ah, okay. Let's go back.
Well, actually, Richard, I've still got 2021 election process, so I don't know whether that's just.
I can see it now.
Okay.
I can see it now.
Marvellous. Okay. So yes, so the first key date is the 4th of March. So if you tonight are thinking about standing to become a governor, or you're thinking about somebody else that might be interested in standing, the first key deadline is the 4th of March to put your nomination in. Just a reminder, as Krishni mentioned earlier on, in order to stand as a governor, you will of course need to be a member first. And as Helen mentioned, it's dead easy to become a governor, to become a member. So do have a look on the website or contact us at the Foundation Trust office, and we can help you with that. I won't read through all of the dates here, but once your nomination has gone in, the voting packs then come out in March. So the 26th of March is the key date there, where there is a competition for seats, which we're hoping to get the best possible candidates that there will be. Those members, as Krishni members mentioned, gets the opportunity to vote on those that are nominated, and then the actual closing date is the 22nd of April. And we will then be announcing the results on the 23rd of April, which is when the new governors will start in post. So yes, the first key deadline, 4th of March for nominations. Do contact us or visit the website if you want any further information about what you have to do to put a nomination in, or if you're unsure whether you're a member.
Thanks, Richard. There's a question from Kurt. Are members of staff able to apply for a public governor role, or are we restricted to just the staff roles? And I think actually staff are restricted to staff roles. So you'd have to, but I think all the staff roles are up for election, if I'm right, aren't they, Richard? So they're all up for grabs in effect. So you just need to look at the one that the group that you fall into, but be aware that you just might be in competition with other colleagues. But you know, that's fine. That's all part of the experience, really, of you know, you'd have to write, if you are standing against other colleagues, you'd have to write a statement and say why you think. And you know, Helen, as she said, she was surprised, but she was standing against 2 others, but she obviously wrote a compelling statement that meant that people thought, okay, we think, you know, Helen might be the right person. So I think it's worth thinking about why you want to be a governor and how you'd hope to make a difference, I think, because and I think, you know, perhaps Helen's story actually was a really good example of that, where she'd actually had a personal experience, a personal insight into something, and she thought, well, maybe I could do something about that. And having that story to tell is probably, you know, quite important if you happen to be up against other people. Sometimes that won't be the case, and you might be one of those people who stand what is called uncontested election. Nobody stands against you, and therefore you happen to be elected. But some positions are more popular, let's say, so sometimes it is just a bit of the luck of the draw, really, on that. So any other questions? Who can nominate? So I think this is from Ali, is it? Who can nominate me if I want to stand? So you can self-nominate. You don't need to be you don't need anyone to nominate you. You just need to decide that that's what you want to do, put yourself forward. And then I think if it's is it right, Richard, that you write the statement if you're actually standing in a contested election? Is that the case?
You'll need to put forward a statement
anyway
for any seat, but yes, it's only sort of operative, as it were, if it's contested. That's right.
Okay, there's a question from Kurt. How much is the weekly time commitment for governors? Helen, what do you think? Well, how much time do you think you put in? It's a bit, how long is a piece of string, sort of, isn't it?
I would say if you did the absolute minimum, the bare minimum, which is to read all the papers for the Council of Governors every 2 months, that paper reading and attending the meeting is probably maybe half a day to a day. But what you find is that actually there's so many interesting things going on that you choose to put in as much time as you can. But bare minimum would be half to a day every couple of months, I think. And I don't know whether anybody else has got any opinions on that. Richard's probably looking horror struck. What? You don't read anything?
No, I mean, I think Helen makes an absolutely correct point. And I think particularly for staff, I think we have to recognise, you know, you have got other things that your other demands on your time. And I think it's fair to say that staff governors in particular will sometimes have more of a challenge, you know, especially sometimes when you're involved in clinical services directly. Naturally, you know, there is a kind of pressure to put the patient first, and we absolutely get that. There are only some fairly basic rules, actually. You just can't miss a council meeting three times in a row. But beyond that, to be honest, it's not, you know, there isn't a really high expectation in terms of commitment. But to feel like it's you're making a difference, to feel like it's worthwhile, it's probably that's when, you know, you might want to think about what else can you get involved in. And that could be anything from getting involved in, let's say, recruitment. So we often ask, I think Helen, you've been involved in interviewing on a panel stakeholder panel for a director interview. Is that right, Helen?
Yeah, I sat on a stakeholder panel for recent interviews, just to give another voice. So the stakeholder panels, I think we're up to 20 odd people sat on them, from all across the organisation.
Yeah.
There's a huge opportunities to get involved. You can get asked to sit on focus groups or sit on committees or read papers and give your opinions, or just asked to get involved in whatever you're interested in, patient experience groups, everything.
Yeah, so there's lots of things that will come up, and we'll say, would a governor like to be involved in this? And then it's really up to you. And that's why there is this really kind of minimum time commitment, which is the attending at the council. Beyond that, it's about looking at the opportunities that come up and say, actually, do I want to be involved in that? Is that something I'd gain from, or I could contribute to, because I feel like I've got something to add to that. But it's, where I would say is that particularly if you've got good networks, either as a member of staff, you're well connected to other staff. So, you can maybe influence, kind of talk about certain things, as Helen said, that might be affecting groups of staff around you. And you'd be interested in kind of contributing that way, or you've got other networks that you're part of. So, it could be other volunteers that you talk to, a patient experience group that you attend. It could be anything like that. And you hear things that you think, that'd be useful to share that insight with the trust, because that might make a difference. So it's all of those things. And I think part of what we try and do, and other governors will also try and help you with, is how do we make it something that means something to you? Because, as I said, I think genuinely everyone's experience is a bit different, and it will depend on your personal circumstances, what constituency you're in, and then make the most of it, and we will do our best to try and help you with that, really. There's another question from Robbie. Are the partner seats restricted to staff of those partners? So yes, they are, Robbie, they are. So we decide with the council, we agree who the key partners should be, that we'd want represented on our council, and then it's up to the organisations themselves to nominate somebody who can regularly attend. And we will review that on a sort of fairly, kind of every few years or something like that. We'll review it to make sure that those remain the right partners to be represented on the council. But the partner seats are the only ones to which people are nominated, as opposed to stand for election. Okay, anything else? Okay, so thank you so much for coming along. It's been lovely talking to you all, and do put yourselves forward if we haven't put you off. Hopefully we haven't. It's a really, I think it'll just give whoever comes forward, if you make the most of it, you'll just get a different perspective, I think, on the running of an NHS organisation, even as a member of staff. And that in itself can be really, really interesting. So thank you so much for showing interest. Really grateful. I'm delighted to see so many different people. Maybe this virtual stuff makes it easier, because we run these things in person sometimes and literally had a one person turning up. So it's lovely to see so many of you. But if you think of anything else, I think, please do feel free to ask the questions. But otherwise, we look forward to hearing that you put your name forward. So anything else to finish with, Richard, that we need to mention?
No, really, just to plug your last point there, Krishna, if you do have any questions or concerns, do contact us at the Foundation Trust inbox. Have a look at the website where there's a whole host of information from the nomination form to more information about a governor. So yeah, really encourage you and anybody that you know that would be interested to put a nomination forward to join us over the coming year.
Brilliant. Thanks, everybody. Have a great evening. Do we want to put the email address into the box there, Richard?
Post it in the chat box.
Yeah, so you should be able to pick that up. And thank you again, Helen, for that contribution. I think it really did help to sort of bring it to life. So enjoy the rest of your evening, folks, and do give it a good thought, and hopefully see you putting your names forward. All right.
Thank you very much.
Take care. Lovely to meet you.
And you. Bye.
Thanks very much.
Thank you.
Bye. Bye.